Joining us in studio, our good friend, Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital. Joe, you were telling me, Saturday you're going to Florida, an award coming your way.
I am, yeah. I'm going down to Orlando. We have our National American Academy of Pediatrics meeting, AAP meeting. So all the pediatricians meet in one city, and they have different things, great program, 5-day program, and some award things. And so, we're going to get the opportunity to do that. Probably my most exciting thing on this trip is on the way back, I'm going to visit my new grandson in Charleston. That really is probably what has me most excited.
Well, you're so humble, though, but you're getting this award. And what did you tell me? One of the first docs in Ohio to get this?
The award's been around 15 years, and it's named after an Ohio doc that I worked with. So that was cool for me. Is Tom Schaefer started the statewide committees on sports medicine back 35, 40 years ago. I got on the committee in Ohio about 30 years ago. And so it's really I've hung around for a long time. Really, it's more a reflection of Children's Hospital. Children's said, let's be leaders in this field of sports medicine 30 years ago. No other children's hospitals had done it. You know, the administrative people pulled me aside, said, hey, let's do this thing right, and really let's do sports medicine 30 years later. And so really it's just kind of a reflection of what we've done at Akron Children's Hospital.
Well, certainly some of that is, but you've got a passion. You've traveled all over the country trying to spread the wealth and gain education in regards to taking care of these young athletes. So I know you're being humble, but well-deserved.
Obviously we still have a long way to go after last week when we talked about that hit to the head, and I'm still sore about that one.
Okay, let's talk about the matter at hand here, and I was talking about it this morning. Kevin Love's toe injury. We first heard, he's not going to make the one trip last week, and now came out 2 days ago. It could be a month, maybe more, and now we're reading in some areas maybe the All-Star break. What do you know about this toe?
Well, not much. They're protecting it they're really protecting this information, so I'm not at all sure. And it's fun to be in the position I'm in because I can speculate about it a little bit. But I saw the same things, and as I've been reading, I probably looked at 12 articles last night to see if I could glean any more. They said the MRI this week showed fluid around the toe bone in the left foot and left foot pain, which probably means a metatarsal stress fracture.
That's what the fluid means?
Yeah, the fluid around the joint means a probably overload stress fracture. So, hey, we're really used to seeing those. And in a clinic like ours, during basketball season with all the jumping and big guys get them a little bit more than some of the guards and things, we see stress fractures in our high school and even junior high school kids. So these are real common. There's 5 metatarsal bones, right? One on the big toe, one all the way out on the little toe, the 5th digit, and all of the metatarsals. They're all somewhat prone to stress fracture. But you're so good and you love to quiz the guys on your team. Which of the 5 metatarsal bones, if you get this right, you're ready to come and join rounds with me, because it's not an easy question. But which metatarsal do you think of those 5 has the most common in sports to get a stress fracture?
I would say the far outside one.
No, I mean, that's the most dangerous one. So I'll give you credit for most dangerous. When they get the Jones fracture, like Kevin Durant and others, though, they usually operate on that right away. That's called a Jones fracture, and that doesn't heal well. So on the 5th metatarsal. Actually, a lot of people say the first, the great toe, the big toe, that one is very rare to get a stress fracture. It's the 2nd metatarsal. It has to do with the pattern of how the foot hits the ground when we run and jump.
I see.
The 2nd metatarsal, and the only thing sometimes can be rest, and if they're advanced cases, sometimes surgery. So last night, the medical team is struggling because you do hear anywhere from, 2 weeks for Kevin Love up to 2 or 3 months he could possibly be out. So he went for a second opinion to the Hospital for Special Surgery in New York yesterday. Obviously, nobody's quite sure, but by the end of the week, I heard Kobe Altman say they want a definitive timeline of what they're going to do with him. And it's not a sure thing, but in our high school kids that will start coming in with basketball with these stress fractures, generally 4 to 6 weeks, the walking boot, the kind of thing that he has that makes you rest, then getting a sense that the bone is healing and start getting their strength back in the foot, and then they're back playing by about 6 to 8 weeks.
So that's mid-January if you look at it for him. I wanted to ask you, that second toe in, that seems to me, and of course I don't want to go down, you're the doc, that almost seems like genetics to me, because it would be tough to injure that with it not being the big toe or the small toe. I could see where you could injure those two stepping the wrong way, but that second one in, Is that more genetics
No,
or
it's not necessarily. I mean, if you look at force plate studies on running, it is the
way
part
you
of
land?
the foot. It's the way we land, and there is a lot of stress applied through that toe. And most all runners, appropriate running and jumping, and so it's real common. The first one, if people have that ligament injury called turf toe, but usually they would mention that. You know, turf toe is what they go to the combine and they say in the NFL it's one of the most common injuries that end careers for NFL players, but nobody mentioned that related to Kevin Love. So I'm thinking more that probably the stress fracture. Second metatarsal is very common. X-rays often don't show it. So unfortunately, if they're still having pain the way he was, remember, he started the season and played a few games. And when these high school kids come in and they say, man, I can't play at all when I'm out there playing, jumping, running, it hurts. And the X-ray's not showing anything. We have to go to an MRI. They mentioned in his MRI fluid around the bone. They said toe bone of the left foot. And that's often what we see is in the lining of the bone, you'll see a lot of fluid. And that means it's probably a stress fracture beginning to get to be, if indeed that's what they're saying. We don't know, but it's fun to speculate. Mm-hmm. But anyway, when they're saying that, oh my gosh, we're not sure, we're getting reports anywhere from a couple of weeks to a couple of months, they still have some work to do. And there's a little controversy there about when Kevin Love will be ready to play for the Cavs.
6 to 8 weeks is what Joe is. And again, question mark, but Joe is just putting out by the time the healing, getting back in shape on the court, 6 to 8 weeks. So if you look at 8 weeks from right now, you're talking the end of December, and really by the time you get in playing shape and everything,
yeah, you
January.
know that. Unfortunately, wearing the flipping over to the fan hat, we gave him an awful lot of money. It looks like a young team that's just going to grow, and he's a guy that, you know, oh my gosh, does that all that money, the contract we gave him this summer, we were happy about that to see that he wanted to stay, but does it end up hurting? It might be hard because of his injury history of really getting another team to want to pick up on that salary. But anyway, let's hope that he heals well from this, gets back. His numbers were good when he started the season, and he was taking that leadership role. So let's hope that foot heals, and we'll keep a close eye on it. We'll keep your audience updated on what the injury is.
I had a parent send me a text yesterday knowing that you come in on Wednesdays, and she said that her son is a runner in the Copley-Fairlawn area, and they think that he might have shin splints, and she's going to take him to the doctor and such. And I thought maybe I could throw that out to you. What is shin splints? How do you cure it? How do you get shin splints? Explain that.
Well, with shin splints, as far as the explanation, Ray, let's just book another half hour of your show, okay? So we'll just go a half hour longer if we're going to get a question like that. It's not easy to explain. It's a wastebasket term, which means a lot of diagnoses get thrown into it. In the early stages, it can be the muscles and tendons pulling on the lining of the bone, which is called the periosteum, and these kids get pain all the way up and down the shin bone, and that's called a pre-stress fracture or periostitis or shin splints. The next step, though, and if kids are going 4 to 6 weeks and it's not getting better, and they're doing all the basics of stretching and icing that these certified athletic trainers do at the high school to get it better, icing it, relative rest, stretching it good, not getting better, it can be a stress fracture and fit right in with what we're talking about this morning. One of the top 2 or 3 most common stress fractures is in the tibia or shin bone. And so a shin splint that's getting worse or not getting better over 4 to 6 weeks probably needs to be worked up for possible stress fracture. So early on, muscles and tendons pulling on the lining of the bone, usually a relative short course of rest and ice and stretching will get rid of it. But in that 10 or 20% where it continues, probably need to see your sports medicine doc or your primary doc to begin to look if it could be a stress fracture.
All right. Great stuff, Joe. Thanks for coming in.
Okay, Ray. Have a great week.
You too. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital.